Okay, today we're going to talk about chapter 14, which is about experimental single system designs. And experimental single system designs are also known as removal or experimental replication designs. And we're going to be talking about 3 basic designs today. I have a slide for each one of those. And to each one of these, of course, along with any single system design, a follow-up phase can be added. The idea of experimental single system designs, as you'll see, is to have your baseline like with ABA, and then implement your intervention, and then remove your intervention and see if your problem reoccurs. And if it does, then that gives more evidence that the intervention was the cause of the design. But there are some limitations to this that we'll talk about, and some advantages. There are two, different types of removals. Sometimes, the idea of removing an intervention from a client can be considered unethical. So sometimes the types of removals, especially with clients, may be unplanned. Perhaps they don't show up for several appointments in a row. They, you don't see them for a couple months, and they still collect their data on their targets. So that would be an unplanned removal. There's also planned removals, and this is one time it's really important to look through your text. It gives you a lot of examples, and most of the examples it gives you are examples not having to do with clients, but having to do with agencies, or I'll give you an example of pizza deliverers, things that where there wouldn't be such an ethical concern. For example, an agency. I'll give you an example in a minute, and you'll see what I'm talking about. And again, as I had mentioned, the main advantage of an experimental design is that you have a relatively stronger causal inferences possible if the data is consistent with your expectation. That is, if you're able to what's called retrieve the baseline. And let's go ahead and look at an example. Let's say this example is you're dealing with somebody with depression problems, and you have them on a exercise program. And in order to determine whether that exercise program was responsible, you have them quit exercising in weeks 11 through 13. And what you see here is that when you have them quit participating in the intervention, the exercise, the problem reoccurs. Now, one can argue that, exercise, you have carryover effects. Exercise, the benefits of exercise build up physiologically. You have muscle tone and that kind of thing. So although it meets your ability to remove the design, it doesn't, you do have carryover effects. Another example, let's think of, instead of depression here, let's think of an agency that has problems with no-show rates, and they have, let's say this was a maybe percentage of no-show rates, and they implement an intervention which is to call the day before an appointment in order to reduce their no-show rates. And sure enough, they do that, and they're able to reduce their no-show rates by about 10%. Let's say that, again, this is a percentage. And in order to see whether it was the calls that were responsible, rather than, maybe it's spring and people just feel like getting out more, and they're making their appointments, we stop the calls. And this phase, we stop doing our calls, and we see that our no-show rate goes up again. And so this is an example where you wouldn't have, as much a carryover effect, I would think. You could argue, well, maybe, over these weeks, people became more cognizant that they had an appointment, but if they didn't get that phone call, they were still less likely to remember. But I think that's a pretty good example. And if you look at the examples in the book, you'll see that most of the examples, have to do with, are non-clinical examples. Now let's say we use the same example, and again we have an A design. So we let's use the same example with our agency. We have a lot of no-show rates, and then we start using the calls the day before, and then we stop calling, and what we see is that we're not able to retrieve our baseline, which means it's unclear that if the intervention was responsible for the observed change. Now again, you could argue, okay, there's carryover effects. People learn to show up for their appointments, so if there was learning that took place, you could argue for that. But again, that's one example. Look in your book. There's another example of an A design on page 327. There's case illustrations, and I'd like for you to read through those to make sure that you understand the A design. Disadvantages, it's not applicable for evaluating interventions with irreversible effects. You notice I talked about exercise. I didn't talk about cognitive behavioral therapy, because any type of intervention where you learn, it's not reversible. You can't just turn off that learning or remove that learning. So if you're doing an experimental design, you wouldn't want, it's not applicable for any intervention where learning took place, or where you expected a lot of carryover effects, because these designs are also subject to carryover effects, which also weaken causal inferences. And in addition, especially in a clinical situation, you wouldn't want to remove an intervention that was working. Perhaps you had somebody, another thing that you could remove would be if you had somebody on a weight loss program, and you wanted to remove it to see if it was a weight loss program that was responsible for the change. You know, perhaps they were counting calories and you wanted them to stop doing that, but it was unethical to do that because you didn't want to stop their weight loss. Maybe they were, you know, diabetic and they were, you know, severely obese, and you wouldn't want to do that. So there are some ethical concerns in ending on an intervention where you remove, where a design where you remove the intervention. So that is the primary limitation of this design, that it ends on a baseline phase, but this is not problematic if the intervention phase is irreversible, meaning what I just talked about is if your intervention effect, like if you did use this type of design with a cognitive behavioral therapy as being designed, if it was, which is irreversible, then your A design would actually, going back to baseline, would actually be a maintenance phase or a follow-up phase, you know, where you basically remove the intervention to see how your client's going to do, you know, when you're not around, and they end therapy. So let's talk about the next design, the AB design. Okay, let's look at an example on page 329, figure 14.2. Here you have a design actually it starts on page 328. It talks about a practical application of you know, like, well, this is an ABA design, but we could